Right. So I'm going to get started, and we're going to present the nutrition piece first, and then Josh is going to present the exercise piece, and then we're going to open it up for questions at the end. If you do have questions along the way, feel free. We don't mind being interrupted at all. As Tracy said, I am first and foremost a JM parent, so my approach is probably different than your typical clinician or dietitian because I have lived the experience. And I think we've all been in the situation where we've been in a clinician's office and we've felt the disconnect, that we felt someone giving us a recommendation and in our head we've gone, you don't get it. You're not in my shoes right now. So I was a dietitian before my daughter was diagnosed, and I would say I'm a very different dietitian now, having lived through it. So that is my daughter, Tessa, and I always have people coming up to me going, that's why I recognize you, because we do have a documentary on YouTube that many people have seen. So, but again, we have lived through it. So we've been through the steroid process. We've been through the anxiety and the depression and everything that goes along with it. And every part of that relates to nutrition and health and eating and food. So we have a very short time together. So what can we cover? We're going to have to get through some things very quickly, some basic things. I'm going to present just some sort of hot topics and things that you might have, some topics you might have on your mind, thinking, well, should I be doing this or shouldn't I? I am available afterwards for questions. I have to present again with the next session, but I'll also give you my email as well. So I do work with a lot of JM families with nutrition individually, so just via email or phone. So I'm always available for individual questions after the conference. I'm going to go over the basic nutrition health guidelines just so that we all have that foundation to start at the same place, talk about some special considerations for JM, some popular diets that you might be hearing about, and then what I consider to be sometimes the most important thing is that what we call the feeding environment. And when we are dealing with children, the caregiver and the child's dynamic around food is critical. So we have many families that are presenting the best nutrition options you could ever have, but are some of our most dysfunctional families in terms of are they setting their child up for a healthy relationship with food as an adult. So that is very, very important, and I'll stress that throughout the talk. The Dietary Guidelines for Americas is kind of our basic approach to nutrition here in this country. I do want to point out that when you see these recommendations, these are made for policy making, so they are not individual recommendations. This is made for leaders and public health officials to then create campaigns to educate the general community. So they are great recommendations. They are not individual recommendations, so keep that in mind. What they have right now is a recommendation to take high-calorie snacks to nutrient-dense snacks. So when we say nutrient-dense, we're talking about things with vitamins, minerals, fiber. Oftentimes these are going to be produce foods, very colorful sorts of foods. Fruit products with added sugars, they want us to transition to fruit, actual fruit. And we have a lot of products on the market that have the word fruit somewhere on their packaging. They're usually not very related to an actual piece of fruit. So trying to shift to actually having a snack or a meal that includes actual fruit and not a fruit product is something they're stressing. Going from refined grains to whole grains. So refined grain is going to be a lot of your white products like white bread, white rice, white pastas, trying to get more to the whole grain versions of those products. And then snacks with added sugars, trying to transition towards unsalted snacks. And shifting from the solid fats to oils. So these are all, one more, sorry, beverages with added sugars to the no sugar added beverages. So these are all, if you go to the Dietary Guidelines of America, you can find information about each one of these things specifically with lots of different examples and recommendations for each of those. Another thing that you're probably very familiar with is called MyPlate, and the approach there is if we were to take our meal or our snack and sort of visually divide our plate in half, The goal there would be to have about half of our meal or snack to be from fruits and vegetables. So that, there's other groups on there, but really that's what they're targeting when they came up with this, is that they want us to approach our meals as snacks as having half from fruits and vegetables. Those are going to be the things that are going to give us all those great chemical reactions with phytochemicals that are going to be our anti-inflammatory and cancer-fighting chemicals. So that's where that's coming from. It does include, of course, our protein foods, our grains, our dairies. Those groups you'll find more controversies about which types are good, which aren't. For a particular individual, is a particular group, whether it be grains, dairies, proteins, is it good for that individual, or what types of foods within each of those groups are going to be good for a particular individual. And then another campaign that we see is, so when they take these general guidelines, they come up with campaigns. And this is a really common one, and this is one that we use a lot with families, whether they have JM or not. But it's 5210 or 5219. There are different campaigns. Our hospital at Seattle Children's has 95210. They've added the 9, which refers to sleep. Some have a 7 at the beginning, which refers to 7 breakfasts per week, having breakfast every day. But the core is 5210, and 5 is for 5 fruits and vegetables each day. 2 hours or less of recreational screen time. That does not include a student that might need to do their homework on a laptop, for example, but it's, recreational screen time only. 1 hour or more of physical activity, and then 0 sweetened drinks. So this is again for the general population. And then if we take it into our own context and we look at a JM child, there can be a lot of trouble achieving some of these things. So 5 fruits and vegetables, I have trouble with that, and I'm a dietitian, so I imagine children certainly can have trouble with that as well. And then if you have a JM child that's having a lot of reactions to medications, their tongue might feel funny, they might have funny tastes in their mouth that are changing the way that food tastes to them. So someone that might have loved fruits and vegetables before treatment may wake up after starting treatment and not want a fruit or vegetable for months. And that is very common with our JM kids. And then 2 hours less of screen time. When we have a child that's not very mobile, oftentimes we have a lot more movie nights or movie days, or sometimes we're watching movies all day long because we're just in a really, dark time right now, or we're just in a really difficult period. So we need to give ourselves a little bit of flexibility within those things. 1 hour or more of physical activity, again, can be very challenging when you're dealing with the limitations, but Josh will address more with that. So I just want to throw that out there, that we do have those general recommendations that are there, but not to try to be perfect with everything. So for special needs or special nutrient needs for JM children, I want to talk a little bit about vitamins and minerals. There are a lot out there, and I'm not going to cover everything because, again, it's very individual what someone might need. But I want to make sure that we touch on a few things that if you're not doing, that you want to have the conversation with your doctor. So for calcium, the general recommendation is 8 to 1,200 milligrams per day for children. Adolescent is more like 12 to 1,500 milligrams per day. Now, you can get some of that from food. So when we talk about supplementation, oftentimes we're supplementing with 400 to 800 milligrams per day, depending on the child's diet. If a child tolerates dairy fine, they can get a lot of calcium from dairy in their diet. If they don't, they can still get calcium from foods. However, the bioavailability of calcium from those foods is not very much. So with calcium, for example, a glass of milk or yogurt is kind of our most bioavailable source of calcium from food. We only get about 30% of the actual calcium that is in that. So if that's our best, imagine the other foods are much less. And a lot of fruits and vegetables will have oxalates or things that will bind the calcium once it gets into our body. So to get enough calcium, if we're talking about an adolescent needing 1,500 milligrams per food or per day, it could be very difficult for them to get that from food. And even with milk and yogurt, we really don't want them drinking 6 or 7 glasses of milk just to get their calcium, because we're going to end up with other issues. Yeah. Vitamin D is another one. Make sure that you've had the conversation with your doctor about that. Typically, there's 400 to 800 IUs per day. Most of the time, if you have a standard children's multivitamin, it's going to have about 400 in it. Oftentimes, a standard vitamin D supplement will have about 400 in it as well. Always check the label to be sure. Many times people will take more than that for vitamin D, and there's a lot of research and attention being given to vitamin D, and we don't know exactly, where that's going with nutrition. There's a lot of unanswered questions. But we do know that oftentimes people can take vitamin D without a lot of side effects, and they can take it in higher amounts. So it's not particularly something that we're real concerned about if someone's taking higher amounts. Having said that, a lot of vitamins and things you don't want to just assume that you can take more of, because more is not always better when it comes to vitamins and minerals. So do have the conversation with your doctor about the amount. You also can get your vitamin D levels tested. I live in Seattle, and we're on the 49th parallel, I think, and about 95% of our population, when they've looked at studies, is deficient. So in Seattle, we have a blanket recommendation that we all take vitamin D, because we just assume that we're all deficient. Certainly with JM kids, we don't want them out in the sun very much, and that's how we get a lot of vitamin D. So we can probably assume that a lot of our JM kids are deficient as well, but you can do a blood test, and then depending on their levels, you can then have therapeutic doses of vitamin D to bring them up quickly, and then have a maintenance dose from there. So again, a good conversation to have with your doctor about that. A children's multivitamin with minerals, that is pretty standard. I would say most doctors are recommending that for their JM kids. I underlined with minerals because there are a lot of products out on the market, and the majority of vitamins are not going to actually have that many different compounds in them. So look for one that specifically says with minerals. So that's going to have things like zinc and manganese and phosphorus, and those you're not going to find in a vitamin supplement. Iron I put as a question mark. You want to have that discussion with your doctor. The standard JM blood work is going to have a hemoglobin or a hematocrit or something that will give us a little bit of a clue to whether that child has sufficient iron stores or not. If they don't, there's recommendations to supplement to bring them up, and then make sure to retest their blood levels to keep them up. But you don't want to take iron if you don't need it. Too much iron is not good, and it also can cause constipation, and we don't need another problem. And then I put probiotics because that is also another common supplement that a lot of people are doing. The only thing to think about there is that there's some question mark with probiotics in the research as to whether it is okay for the severely immunocompromised patient. So if you have a child that, and a lot of JM patients with their treatment get to a point where they're not as severely immunocompromised, but if you're still doing high doses of medications and you're considered, your child's considered immunocompromised, you just want to have that conversation with your doctor. The jury is still out with the probiotics, whether it's okay for the severely compromised or not. There's just a lot that we don't know about it yet. But for the most part, many people find that they feel better on probiotics, and it doesn't seem to be a problem, but it is a conversation to have before starting them with your doctor. I wanted to bring up the medications and the side effects. We touched a little bit on this in the tween session. They talked a lot about side effects and medications, just of how it affects our teens and our tweens. This affects our nutrition greatly. It affects our mealtime. So nausea and vomiting, that one's very obvious. Constipation, again, a lot of medications and or vitamins. Sometimes we're doing so many vitamins that is causing the constipation. So sometimes we need to scale back and relook at that. Taste alterations and metallic tastes, like I said before, can really affect the quality of the food that the child is willing to eat. Their appetite can go up or down. Strong cravings, especially for sweet and salty foods. Children naturally have more of a draw towards sweet and salty foods just being a child, and then you add in the medications and it can intensify those cravings. And then their fluid needs are increased because their body is having to process all these medications that we're putting through it. So they do need to drink more water. However, they oftentimes aren't very thirsty. So that can be a real tough one to manage. I wanted to talk about steroids quickly. Weight gain, of course, is one of the side effects, and we all know about that. It is from the adrenal changes. It can also be from an increased appetite and increased intake of food. However, we do see children with the rapid weight gain without much difference of increase in calories. So, as a parent, of course, we want to be cognizant of the fact that they can gain weight very fast, and we want to have smart choices and a smart lifestyle around that. But we also want to forgive ourselves a little bit, or give ourselves a little bit of grace in that if our child does gain a lot of weight, don't put that all just, oh, it's our fault, we must not have done good enough. Sometimes it just happens, whether the child's eating high calorie, low calorie, sometimes it just happens. I do have handouts in the back. So one of them that we have is a low calorie, low sodium snack list. So that's real helpful for families where the child just wants to eat all the time, and they'll eat a huge plate of food and they're still hungry. So we have a snack list, or a food list that's been developed that has some great ideas that has been really helpful for a lot of families. And then again, with the steroids, bloating, discomfort, high blood pressure are all side effects. And if they are having a lot of sodium in their diet, they're going to be more uncomfortable. That high sodium food is going to make that bloating and that discomfort even more uncomfortable for them. So not only is it an issue with blood pressure and nutrition, it's also an issue of just keeping them comfortable. So again, the handouts are on the back for that. It's also posted on the CureJam website, so you can access it there. I do want to make sure everyone knows how to read a label, because if we're not doing that right, then we're not able to bring home the best choices for our family. So for sodium, less than 250 milligrams of sodium per serving is typically what we would consider a lower sodium food. And this again is packaged foods. Ideally, we're doing a lot of unpackaged foods and homemade cooking. But one thing to realize here we've got one that says sodium is 870 milligrams. But if we look closer, we have to multiply that by 2. So this is actually a can of chili. And I chose this because when my daughter was going through the steroids, for some reason she loved chili, and I tried to make as much homemade chili as I could, but sometimes you just can't keep up. And she wanted this chili, and we were traveling, and that, if you times that by 2, we're looking at over 1,700 milligrams per day. That is almost your entire amount of sodium for a child in one meal. So, and oftentimes our little kids on steroids, they don't want a half a cup serving size. They want the whole can, and they'll eat the whole can, and they'll still be hungry and want more. So how do we deal with that? It can make them very uncomfortable, and it certainly isn't good for their nutrition. One thing that can help is, we can't say no to everything. It doesn't work. We've all tried it, and it just doesn't work. So we have to find those middle grounds. And children can understand the days of the week, and so oftentimes you can say, okay, today's Saturday. Do you want your can of chili today? We can have our next can of chili next Saturday. And so that's a way to give them a little bit of enjoyment, a little bit of pleasure from food, but also teach them balance and teach them that this isn't something that we can do every day. In terms of special diets, I really want to stress that food is individual, and what works for one person is not going to work for someone else. So food sensitivities are a real thing. There's a lot of talk between food allergies and food sensitivities. When it comes down to it, if you don't tolerate a food, you don't tolerate it. whether it's labeled an allergy, whether there's a blood test or a skin test that shows an allergy, doesn't really matter. If your body doesn't tolerate a certain food, then it's probably not a good idea for that person to be eating it. So regardless of testings, sensitivities are a big thing, and so pay attention to that. And then I wanted to touch on gluten. Is anyone doing gluten-free or reduced gluten? So that's a big topic right now, and a lot of people are finding feeling a lot better without gluten or with lowered gluten intake. Some people have to go gluten-free. If your child's autoimmune disease overlaps with celiac disease, they have to be gluten-free. There's no question about that. There's no flexibility in that. If they're not a celiac kid, then there could be some more flexibility there. So if you think about a typical preschool, grade school child's diet, oftentimes they might wake up, they might have some waffles or pancakes or a slice of toast for breakfast. They might have a sandwich for lunch or mac and cheese. They might have a snack of crackers and fruit. Dinner, they might have some bread or pasta. Dessert, they might have a couple cookies before bed. All of a sudden, all those foods I just named are gluten-containing foods. So if they're having 4, 5, 6, 7 doses of gluten foods in a day, that would be an unbalanced diet. And anything, whether it's a healthy food or not, if we're doing it that much during the day, we're going to have some imbalances in our intake, in our diet. So I can see how a lot of people can become sensitive to gluten because our diet, our American diet, is so heavily based in gluten. So having said that, do we need to go gluten-free? Most people probably don't, but if they lower their gluten intake and replace gluten or wheat foods with other types of grains, they can feel a lot of relief. So going from one extreme to another oftentimes isn't necessary, but balancing somewhere in the middle can be good. I'll also mention that same thing with dairy. Oftentimes people want to go dairy-free, and if they look at their diet, especially a child's diet, there's a lot of milk, there's a lot of cheese. Cheese is like our little golden snack with kids sometimes, and there's a lot of yogurt. And so again, sometimes dairy is one of those food groups that can become overconsumed, especially with children. And we can see, oh no, we're starting to have stomach aches with, maybe it's the milk, maybe it's the dairy, and so we'll go dairy-free, and it can be helpful, but it can also be very difficult to entirely eliminate a food group from a child's diet, especially when they're going through JM treatment. So again, just scaling back a little bit, oftentimes people can find relief with that. FODMAP I just wanted to throw out there. This is because it's something that is being talked about a lot. I have some information if anyone's got questions, or we can talk more later. But that's basically, it's used a lot with IBS or irritable bowel syndrome. So when you've got some GI symptoms that are sort of unexplainable and you can't really pinpoint it on any type of food, this is a digestion of types of carbohydrates, certain types of carbohydrates. So that is something that you might hear about, and I'm happy to talk to someone if someone's interested in that. Nightshades I put up there. This is on the arthritis website, so I always like to include that. Yes or no. Those are tomatoes, potatoes, peppers, eggplant, and paprika. Again, we don't know if these are contributing to any arthritis or rheumatology disease, but it is something that is talked about a lot. So you might pay attention to those foods and take those into consideration. In terms of anti-inflammatory benefits, there are a lot of anti-inflammatory talks out there in different types of diets, so I'm just going to put those up there. What I want you to notice with these is that they're all different. So when we start to talk about an anti-inflammatory diet, oftentimes we're sort of on polar opposite sides. Some anti-inflammatory diets are have a lot of protein and animal proteins based in them, and other anti-inflammatory diets are completely plant-based. So knowing that there's a ton of information out there, and it is all very incredibly confusing. And I do nutrition every day, and it's confusing to me as well. So But these are some of the ones that are out there, including the autoimmune paleo that is listed as well. Again, sometimes it might work for some people, and we have some people that it has worked. Other people, absolutely not. So what this does have in common is that they are all stressing real food, a commitment to preparing food at home and not buying a lot of packaged items, not buying a lot of processed things, food additives, colors, added sugars. That's what these all have in common, which are all wonderful recommendations. Check our time here. Okay, I'm going to finish up here. Okay, so, and these are, I just listed a few foods, and again, this will be on the Cure Jam website, so don't feel like you have to frantically write them all down. But these are just a list of foods. You don't have to eat them every day. What I like about these foods, they say that some of these foods could have some potential anti-inflammatory benefits, and I like to think of food as medicine. If we're not putting quality things into our bodies, then we're not able to really validate the efforts of the physicians that are treating us, because the medicines and the treatment is probably not going to work as well if we're also putting a bunch of garbage in our body. So these are some things that could be beneficial. What I like about this list is that a lot of these can be put into a smoothie for kids, because a lot of these foods kids maybe aren't going to want to eat, but a lot of these can be put into smoothies, and most kids will accept a lot of these. All right. I want to see for time. I'm going to finish here. I just want to touch on the feeding environment before Josh starts. And again, this is what I would probably consider the most critical part of our jobs as caregivers. We can create a great environment, or we can potentially lead a child to an eating disorder. And that is not what we want to do. So I always like to use my little friend the fly and say, if a fly were on our wall during mealtime, what would they see? And I've done this with my own family, where I'll secretly just videotape on my phone some interactions, and then I'll play it back for us, and we'll just kind of laugh at ourselves. And we think, what were we thinking? So does mealtime look like this? Sometimes, maybe. Does it look like this? Where we are exhausted at the end of the day, and the last thing we want to do is cook, and we're ready to zone out? Eating in the car. I'm in the soccer mom phase right now, and there's a lot of this happening, and it's very challenging to feed a family when your schedules are very demanding. This is more typical, and these are the families I work with, all of them. The little guys, of course, he's done. He doesn't want to eat. Either he doesn't want to eat what's served, or he doesn't want to eat at all, and that's okay. If we push and we push and we push, we're not going to get anywhere, and we're going to create even more negative problems. And then the bottom picture I love, because, JM families, we're a little higher stress level than the average family. So we need to recognize that and just be aware of that. So what does a positive food environment look like? It means making mealtime a priority. And that is very, very difficult, but the benefits are huge. They're showing that children that have a family mealtime, they have better grades, they have less risky behaviors as adolescents and young adults, less drugs, all of those things. And they have better family connections, which at the end of the day, that's what we really are looking for. So involve your children in the food selection. I have some handouts in the back that have examples of healthy meals, and we like to use that, and I've had a lot of feedback from families that they just post that on their fridge, and then once a week each child in the family gets to pick, and it gives the child ideas of a healthy meal. They're not going to have mac and cheese every time. Okay, if you're going to have mac and cheese, what else goes with the mac and cheese to balance it out to make it a healthy meal? And so those are great, because the kids can just pick what looks good to them. And then allowing them to practice their own portion sizes is very important. The little ones are going to not be very good at it when they start, but they will get better. self-regulating how much we eat is an incredibly important part of nutrition for young children. And if we are establishing the portion size for them and we are telling them that they have to have more because they haven't finished their plate, or no, they can't have that much, we've got to watch ourselves there, because they are not then learning how to self-regulate their own appetite. And that is one of the greatest skills that they can learn as they grow up, is listening to their stomach and saying, my stomach is telling me I'm full, so I'm going to stop. If then our trusted caregiver comes in and says, no, you're not full, you're going to keep going, then we're going to lose that self-regulation. So offering healthy meals and healthy choices at Meals and Snacks, that is our job. And then using snacks as an opportunity for healthy choices. So snacks, when we say the word snack, oftentimes we think of a package, and we want to get away from that. Snacks can be a wonderful opportunity to get more fruits and vegetables in our kids. And a lot of us do, with young children, we do story time, or even older children. My kids are 13 and 11, and we still read out loud together every night because we've just always done it, and they love it. But one thing that can help is at that story time, have a fresh cut plate of fruits and vegetables. And I always say, as long as they're still chomping away, I will keep reading. And that's how in our family we can have some time together, but also make sure that if the day doesn't go well and we're not eating very healthy, at least we can always have a good ending to the day. Offering new foods along with familiar foods. So no one wants to sit down to a meal where there's nothing that they like. I don't want to do that, and we shouldn't expect our children to do that. So if we want to introduce a new food, put it alongside one of their favorite foods so they're excited about the meal, and then maybe they'll be in a better mood to try something new. So you do want to set the expectation that trying new foods is a part of being healthy, but not making it a negative or pressuring situation. And then never giving up on introducing new foods. So one thing to talk to children about is that they are growing and they are changing, and along with that, their taste buds are going to change. And especially with JM, their taste buds may change from day to day depending on what medicines they've had each day. So teach them that. Let them know that that's okay. If you don't want your strawberries today, that's okay. Maybe they'll taste better tomorrow. And they can just approach. And as you grow older, your taste buds are going to change. And even if you don't like broccoli today, you might like it next week. And we'll just try it again next week. And then very importantly is to model trying new foods. So we like to, once a month say, let's just try something new. And we all go out of our comfort zone and try something we've never had before, or go to a restaurant with a different type of food that we've never tried. And then lastly, just focusing on the family and not the food. Again, trying to have positive interactions with food and create a relationship with food that is healthy. And I think we all have experiences from our childhood, positive or negative, around mealtime and around food, whether we were forced to eat things or how healthy the food selections were that we were offered. So keep the conversations positive. Keep them around positive topics, not around the food, not around keep eating. One thing that's really fun is, I call them dinner games. You can call them conversation topics. We started when my youngest was 1 and my oldest was 3, and they have toddler versions. And it's great. The goal there is to keep them at the table, because little ones don't want to stay, right? They're too busy. And so if you can keep them at the table with the conversation and the connections, they're going to look forward to mealtime. And if you can keep them at the table longer, then you can have more positive nutrition benefits in the long run. So I'm going to summarize and let Josh start, but in summary, eat real food and look for the imbalances in your child's diet. We mentioned a couple of where those could be. Make changes very slowly and gradually. Just take baby steps like we do with everything with our JM kids. We can celebrate every single success. And so if they try a new food one day, that is a success, and that should be celebrated. Have the proper vitamin and mineral supplementation needed for treatment. Low sodium foods are very important if they're on high dose steroids. And then get some help if you want to do a special diet, and I'll have my email up as well. But definitely, if you want to do a special diet, you just want to have a conversation about that and some support. And then model a healthy lifestyle for your family. We don't have to be the guy on the left by any means, but we could probably be a little more engaging than the mom on the right. So trying to be that model, whether it's in physical activity or nutrition. And then investing in your child's long-term relationship with food. That is really probably one of the most important things I hope you that sits with you from today. And then lastly, just have fun. Make food a very fun thing. Even if a child is going through a phase where they're not eating well or they're really struggling, just play games with food and make it silly and fun, and they will come out of it someday. And in the end, when they're grown, hopefully it will be a benefit from them. All right, I'm gonna let Josh start.
We doing okay? Need to take a standing break for a sec? You guys are pros. All right, well, roll into it then. My students are less engaged. They have to stand up every half an hour. They get mad. So, all right, I'll switch over here. Okay. So I'll talk a little bit about exercise, and away we go. So I hope to accomplish the following things today with this presentation. Talk about the vocabulary of exercise, because in our culture, we're obsessed with exercise and looking good, being attractive, being the best. You know, we have a very aggressive, competitive culture. So let's sort of define what we're really talking about here, first of all. Talk about physical fitness, what that means, what the benefits are of physical fitness, some of the traditional views of exercise, how we engage in it, what the benefits are that we receive from it. And then finish up with a little bit on the research currently with juvenile dermatomyositis and how we understand exercise currently with our scientific endeavors. So when we talk about exercise, what comes to mind first of all? Perhaps this. She's very happy. The guy in the background's very happy. They're doing some sort of thing together in a class, right? They're paying $100 a month to be in some fancy gym downtown, right? But they take care of themselves, right? There's this aura of being a good person if you exercise, right? You care about yourself, take care of yourself, right? That's how we look at it. Maybe you're like this individual. You like to flip heavy tires for exercise or do very impressive feats, throw spears, you know, run in the mud, right? We have a whole bunch of different things we can do for exercise today. And then last but not least, this is, before I had kids, I was like this, believe it or not. Just kidding. No one ever believes me on that one for some reason. But this is the quintessential exercising guy, right? He takes care of himself, he works out, he looks very impressive, very aggressive. You know, that's who we want to look like when we grow up, right? Superman, thank you so much. So this is the culture that our kids are growing up in, and these are their role models, you know. And if you have a condition like JM, it can be very difficult to see the gap between these people and where they are. It can be very depressing. So as parents and caregivers and health professionals, we have to help them change their view of exercise and fitness and what really is reality and what really should be our goals and our targets. And so let's talk a little bit about physical fitness. So if I had to ask you a question in this picture here, this looks like a nice, cute little interaction here. We assume they're exercising, not looking for something on the road. Who was more fit in this picture, if you had to venture a guess? Is this a sneaky trick question by a presenter? I don't know. I don't want to answer. All great answers in science are, it depends, right? It depends. I would submit to you they are both equally physically fit for their circumstances. And they look very different than someone like this, obviously, right? But they are getting as many health benefits from exercise as probably this individual is, believe it or not, if done properly. So let's define really quickly what is physical fitness. And this is a very textbooky definition, but it's part of science, right? Basically, it's the ability to carry out daily tasks with vigor and alertness, without undue fatigue, and with ample energy to enjoy leisure pursuits and to meet unforeseen emergencies. So that's a very broad definition of fitness. So if you think of yourselves, you know, we may not look like this guy. A few of you probably do. Take your shirts off. But if you defined your fitness level with this definition, you know, be nice to yourself. You're probably fit, probably adequately fit for your lifestyle and what you're doing, right? And there are many components to fitness: cardiorespiratory, muscular, strength, body composition, flexibility, balance, agility, reaction time, power. The list goes on and on and on. But fitness is the take-home message today. It's being able to do what you want to do with meaningful activities without undue fatigue. Physical activity, we talk about all the time, is any bodily movement, and I've underlined here, essentially above resting levels. So physical activity is getting out of your chair and moving around, right? And that could be anything. It could be dancing, gardening, walking your dog. It's a whole range of activities. And of course, exercise, by definition, is planned, structured, and repetitive, with the final or intermediate goal of improving or maintaining physical fitness. So again, fitness is a little individual, right? We can't just say this is fitness for everybody. It really depends on the individual. Exercise merely gets us there. But guess what? Physical activity can also get us to physical fitness. Right, so put them all together, and we have this sort of low-tech graphic right here. Thank you, PowerPoint. Physical activity is the big idea, and exercise is a component of that physical activity. But the whole goal, again, is to improve fitness. So why improve fitness? What are some things you guys have heard? Why do we care? Good thing you're here today, then.
Lower risk factor for cancer.
Okay, I hear lower risk factors for disease. Anything else? Live longer. Oh, the controversy. Can we increase lifespan?
Better
Emotional health, right? Mental health, right? Okay. We're on a tight time schedule, so I'll just move ahead, right? Yes, it has been shown time and time again that exercise really can decrease your risk for certain diseases. Things like heart disease, stroke, diabetes, blood pressure, some types of cancer are decreased with mild increases in physical activity. Reduce disability, and this is more important for our individuals with JM. It's being able to move around, to walk, to stand, to take care of yourself. This requires a baseline level of physical fitness to do these activities. And of course, improve quality of life. And this is specifically health-related quality of life. And lastly here, depressive symptoms. All these things have been shown to improve or decrease, depending on how you look at it, with increased physical fitness. This is why we care about fitness. Again, not taking our shirts off and flexing in the mirror, but getting these kinds of benefits we're really going for with being physically fit. So how do we improve fitness? $1 million question. There's billions of dollars poured into the industry every year by well-meaning people trying to achieve something in the gym, right? And so basically, if we take all that out of the picture and just get back to what we really know from a scientific standpoint, first of all, just begin by increasing your physical activity. Our culture, we have a lot of technology and we're all very sedentary. Sometimes we're forced to be sedentary. Just get up and move around a little bit more and you're already on your way to improving fitness. This is a big deal right now, disrupting sedentary time. And I think we all know what that means, right? We're all guilty of sedentary time. I've been sitting here still for the last 45 minutes, right? It's part of our culture. We sit a lot, right? Sitting down, playing video games, being on the computer, on your phone, watching movies, TVs. These are all great activities, but again, we're sitting, being still. So we need to really progress from where we are to the next step, whether that's being more physically active, whether that's decreasing sedentary time. It can be as simple as standing up. If one of your kids is very, very sick and they're in a difficult phase of their treatment, they may not feel like doing anything, but just standing up for a few seconds is a whole lot better than just lying there for a whole day, right? Now, that depends on the individual, but that's as simple of a change as we can make to improve physical fitness by just disrupting that sedentary behavior. And it's been shown to have big benefits for all people. And so another take-home is we can't always see fitness, right? Again, don't be fooled by our culture. You can be very fit and look very ordinary, right? So don't mistake this whole idea of teaching our kids they have to look like their sports role model, right? Again, change the focus to being more physically active and being fit. Don't make them think they have to look like they're an elite Olympic athlete to be happy and successful. It's not true. That's a marketing ploy that's very successful, but it's not reality when you look at the science of how our bodies work. So, switching gears to exercise is why we're here, right? Talking about exercise. What is traditional exercise? Some things we should understand when we're dealing with JM and all of us actually is the overload principle. What does that mean? we have to take our bodies and make them do something beyond what they're used to doing to see any kind of a change. We have to overload the system. And so the body has to respond to that overload. If we don't push it where it's comfortable being, we're not going to see any long-term change. That's the overload principle. We have to introduce that stressor multiple times to see an adaptation, to see a change in how our bodies function. If we're not doing that, we're not getting any benefits for our fitness levels. Progression. Our bodies are dynamic. They respond continually to environment, to what we're doing, what we're eating, and so on. As we adapt to one stressor, we have to make it more aggressive, make it more challenging for our bodies. If we don't do that, we plateau, the dreaded phase of weightlifters, right? Oh, I plateaued, bro. I know. Want to keep progressing and getting stronger as we move forward. Specificity. We have to, if we want to walk better, swimming, while it's a great exercise, probably won't improve your walking ability. We have to train specifically to the thing we want to improve. Many famous athletes have been very great in certain disciplines, cycling and running, and they switch disciplines, and what happens to them? They're somewhat forgettable because they're not as good in that other discipline, right? Our bodies adapt to exactly what we have them do. So as you pick your exercise, make sure you're doing exactly the kind of activity you want to improve. That's called specificity. The dreaded reversibility, that means if we stop doing something, what happens to our bodies? We lose any benefits. And here's the scary thing. We lose much faster than we gain. Studies show that even 24 hours of being sedentary, you see reductions in physical performance. So it happens very, very fast. And lastly, dose response. We always know in our culture, if some was good, more is better, right? Well, in exercise, that's true to an extent, but I promise you, jogging 7 days a week will not give you that much more benefit than 5 days a week, right? It's a little benefit, but it's not linear, right? So going from sedentary to a little bit active has a huge jump in benefit, and going from 5 days to 7 days is a very small jump. But it does depend how much we do, right? So again, the goal would be for our kids and all of us to go from where we are to getting a little bit more to see more benefits. That's dose response. So what kinds of exercise do we have? There's the classic aerobic exercise, been around forever. By definition, it's just elevating your heart rate and using major muscle groups in a repetitive fashion. That's all it is. The recommendations for the general public currently are to do 30 to 60 minutes a day of aerobic exercise 5 or more days a week. And luckily for us that are very busy, you can accumulate that in small chunks. You can do 10 minutes in the morning, 10 minutes at lunch, 10 minutes at night. Add it together, that's your 30 minutes. That's all it needs to check that box, actually. How do we do it? Right now, it seems that higher intensity has better benefits for general population. For our kids at JM, that's still up in the air a little bit. We'll talk about it in a few minutes. But if you look, when we see a benefit from aerobic exercise training, burning as little as 500 calories a week, which is walking 5 miles in 1 week, is enough to see positive health benefits. So it's actually less exercise than you think to start seeing those benefits we talked about previously in the earlier slides. That's generally aerobic exercise training. And this can be done walking, biking, treadmills, jogging, all those things, dancing. As long as you elevate heart rate for a period of time, that checks the box as aerobic exercise training. This is the classic muscular fitness training. The whole idea is to improve force production or the size of our muscles. There's different kinds of recommendations depending on what we want to accomplish. If we just want to get stronger, that just means to be able to produce more force with our muscles. You just need to do this twice a week. Exercise each major muscle group 8 to 12 times, that's repetition. 1 to 4 sets, 2 times a week. That's all you need. It's surprisingly less than you think. Now, if you're going to be a competitive athlete, if you're playing sports, you need much more than that. But just to go from where we are to getting stronger, that's all you require to do that. Power just means producing more force in a shorter period of time. We have a slight modification. We move faster when we train for that. And endurance training, being able to resist fatigue in our muscles, we have to get lighter weights in more repetitions. And as little as 2 sets is all we need to see that sort of benefit. So these are the basic foundation for strength training recommendations currently in place for all of us in the population. If you're an exercise guru, this is a paper that looked at different kinds of exercise. But look at the top 3 rows. Bodyweight exercise, which is like doing push-ups, pull-ups, that kind of thing, has very modest improvements in strength and muscle size. The machines you see here, we see a little bit more improvement, and then free weights and weightlifting activities, even more improvement. That's the typical progression for individuals. Body weight first, then go to machines, and then go to free weights. It's typically how we would progress exercise training. There are many other ways you can do exercise here. We can talk about later if you want, but there's always a product to buy to exercise. So some just comparisons for your benefit here. Flexibility, we want to stretch basically to improve range of motion. And there are some benefits, but I just want to caution you about stretching. It's a little controversial in rehabilitation science because if you stretch a muscle out and you loosen someone up, that may require more muscular energy to maintain a posture. If you have someone with JM who's got very challenged muscle function already and you're making them very flexible, it may require more muscle energy to maintain your posture if you're more flexible than if you're more stiff. So that's a conversation to have with your physical therapist or rehab professional. So don't just blanket prescribe stretching for everybody. Just know it's a little nuanced in that regard for our individuals here. And this is also somewhat controversial, but there's really no link to injury prevention and stretching or muscle soreness. So everybody in the world does a cool down or a warm up with stretching, but it doesn't really mean it really does what we think it does. So I could talk for hours about the controversies of stretching, but just know that's where the science stands right now. We do know it's most effective when the muscles are warm, take the most benefit, and it's as easy as doing 10 to 60 seconds, 2 to 4 times a day, 2 to 3 times a week. Just holding a gentle stretch is all you need to really improve flexibility. I'm going a little fast, I apologize, but if you have questions, we can talk to it. We can talk afterwards, or you can email me specific questions if you want. So don't panic, this is too quick. Neuromotor exercise is basically things like yoga and Tai Chi. We're incorporating balance with flexibility and sustained postural positions. There are many different versions. If you're older, there's been shown to be a lot of benefit to that kind of exercise. But if you're younger, it's really equivocal. It's hard to say if it really is beneficial. So don't rush your kids into yoga or Tai Chi just yet. And last category of exercises are these what we call functional exercises, where you basically don't care about repetitions or sets. You just go until your muscles fail. We would not recommend this for our kids with JM, of course, right now, or most of us probably for that reason. But better to have a conversation with your rehab professionals with this kind of exercise training. Just know that it exists in many forms out there. So the big question of the day is exercise safe for inflammatory myopathies? That's the whole reason we're here, right? And we asked that question because this is a slide, and don't worry about the biochemistry of this slide here. This is our current understanding of the disease, some of the disease processes involved in JDM. And if you look at this, there's a lot of biochemistry here. This is a muscle and a capillary right here. And so when we exercise, we have a lot of responses and changes in our body's biologic function, temporarily and long term. So the big question is if we exercise, are we going to mess with these disease processes? If you look at the slide we see here, we have muscle atrophy, we have muscle destruction, cell death, and the capillaries are being destroyed as part of the disease process of JDM. So the big question is, if we exercise, are we going to make this worse or have no effect? And so that's why exercise is so cautiously prescribed in some circles. So the problems that we see with JDM, of course, are weakness, muscle fatigue, decreased bone density, lower quality of life, and medication side effects, not to name many of those, right? So these are already happening with JDM. And the medications we take are trying to stave these off in many ways. But I ask a question. If we stop moving around and sit on the couch and don't do any exercise or any movement, what likely happens to all of these problems right here? That's the dilemma, right? Most of the time, these problems get worse as we're sedentary, right? So we can't just say, don't do anything, wrap yourself in bubble wrap and don't move, right? Because if you do that, these things will likely get worse. So there are a couple studies that look at exercise specifically in JDM. And these are the big papers you see cited most of the time in all the research. And we'll talk about these very briefly individually and pull some lessons from these exercise papers. The first one in 2012 had a blend of younger people, mostly with active disease and a few with non-active disease status. Then in this crazy exercise program, 12 weeks of strengthening major muscle groups. Do these numbers look familiar for you guys? It's 12 reps, 3 sets. That's the same recommendation for all of us, general recommendations. They did treadmill walking for half an hour at a pretty good intensity. Again, that number look familiar? Same recommendations for all of us, right? And a little bit of stretching. Well, what did they see? They saw improved quality of life, increased strength, bone density, and aerobic fitness. Okay, that's great. We would expect that, hopefully, right? But that safety question is always nagging. Were there any problems with the participants? And the answer was no in this study. There were no injuries, and no one's disease got worse from having done this for 12 weeks, as reported in this study. This is a very important finding for this population. So they were doing, it looks like they were doing, I believe, 3 times a week is what they said. I don't know, it was twice a week they were doing it, yeah. The second study here, a little bit later, we had people in remission from their diseases for, a year to 30 years out. And again, this was a little more aggressive. They did this every other day for 12 weeks, so only one rest day in between exercise sessions, on a bike for up to 40 minutes at a time at a pretty good heart rate, which is pretty intense intensity. And most of the people completed 12 weeks. And again, we saw improvements in aerobic fitness. They could walk a little bit better. And again, we see no change in disease status, which is always good to see. That's the nagging question of safety, right? And last but not least, muscles and motion study. We have 2 different groups and a little more sophisticated study design. We'll skip over that for today. Basically, we're doing a home-based exercise program 3 times a week for about up to an hour each time. And so they're doing intervals, which means you do a few minutes on a treadmill and you take a break for a few minutes and do a few minutes more. So you kind of off and on kind of approach exercise training. And as you look here, they got pretty aggressive as they progressed the exercise training. In addition to the treadmill intervals, they were doing a bunch of strength training, squats, sit-ups, push-ups, using body weight mostly as the resistance. 3 reps, 3 sets, and they went from that kind of training to sort of a power training approach where you're doing as many as you can in 30 seconds. And so most of the people were able to complete this sort of training. The results were, again, very encouraging. People who finished the study saw improvements in muscle function. They could jump further. They could do more push-ups and sit-ups in a period of time, increase in power. And they saw a decrease in disability measured via the chalk. And most importantly here, there was no worsening of disease symptoms with this kind of exercise training regime. So there are a few questions here before we summarize. What we need to understand better with exercise is how do we adjust exercise during active phases of the disease? There's still more research to be done in that area. We have to understand different subtypes of diseases need different kinds of exercises. We don't know just yet. More research is needed for that. And again, how do we get the best results in the shortest period of time? A dosing type question. Those questions are being answered currently. To summarize what we have here, as published, exercise does appear to be safe for people with JDM, which is good news. The following exercise forms have been shown to be successful in improving lots of different outcomes. We know that exercise, if you're walking, exercise, bike riding, aerobic exercise, that seems to be safe and effective in improving aerobic function. Strength training using weights and machines and body weight also seem to improve physical strength and performance when done, has been published here. The thing that I think is interesting is these studies really just employed current recommendations for all of us. And they weren't very special. They were just sort of general applications of exercise training. The same thing that would benefit you and I benefited these individuals with JDM. So that's very interesting to know that it's sort of a universal phenomenon. Also, as we summarize here, again, seek to improve fitness. Not to look buffed or whatever your metric is, but to improve how our bodies perform is really the goal of what we hope to accomplish here. If possible, disrupt sedentary behavior always. Again, as simple as standing up for 10 seconds disrupts behavior enough to see some health benefit. And when activity is easy enough, you can progress towards exercise when appropriate. But it's almost always individualized as you progress towards exercise training. We're doing current research projects to better understand how we can use exercise in JDM. But lastly, help kids really understand the difference between cultural myths of exercise and really fitness and the benefits of fitness. You'll do more for your kids showing them that than anything else, I think, in this presentation here. And as they improve their fitness levels, they will feel better and have less disability, as we've shown in the research here. All right, and I think that's all I have for today. And we have a few minutes for questions for Julie and myself. And if you have further questions, I'm happy to email. You can send me an email and we can chat more online. So thank you very much.
This is for exercise. Pain. You can do the activity for a little while, and then you get 3-4 days of intense pain. That's the issue with exercise with mine.
Right. And so that's another area. Oh, I'm sorry. I need to repeat the question for our online audience. The question was muscle pain. You do 2 or 3 days. So your child exercises, and there are 2 or 3 days of pain after exercise.
It's as simple as so he'll go out for a walk.
Okay.
We'll say, let's go out for a walk. He used to do a lot of taekwondo,
Mm-hmm.
and then he's out of that, and his activity level is going lower and lower and lower. So we're trying to get it back up, so he can go out and do it. It's no problem doing it, but he'll be in a lot of pain the next couple of days, which means his activity level, he wants to not do anything.
Right.
So.
Yeah, that's a tricky question for individuals. Better talk to your physician about pain management a little bit. But typically, if you look at exercise training, does it depend on how much he walks? Is it even if he goes for like 5 minutes, he has the same degree of pain afterwards? You've noticed a pattern in his pain post-exercise?
It's when he'll go out and do more. So he'll go out and play for a half hour,
Mm-hmm.
and then the next day he's non-functional.
Right. So typically, that would be a classic sign of sometimes overtraining, overdoing it. And so the question becomes, do we need to modify the activity? Would cycling or doing some sort of aquatic activity have a different effect? Is doing less activity beneficial? So there's typically a threshold that you'll see with individuals where if you do about past this threshold, then you have these sort of side effects after the next couple of days. The hard thing, though, is that threshold varies from day to day. And so that's a very difficult question to answer, I think, in this sort of setting. We need probably a little more understanding of the specific medical condition of your child, and would be better addressed probably by a physical therapist and a physician. Where do you live?
Live here, and they're doing that.
Okay.
He does aquatics.
Perfect.
Twice a week for a clinic. He does the cycling. He has weekly PT. We've been doing this for years. So.
And no change, same pain after all those activities?
Yeah.
That's tough. Yeah. I don't know if I have anything to add to that. We can chat afterwards a bit
I was
more.
just curious as to what
Yeah.
you had.
The pain side effects, yeah. I haven't seen anything that really addresses that effectively just yet. And so it's an interesting question, hard question. And I hope you guys, I wish you the best with that with your current medical team. That is definitely tricky. Yeah.
A couple of quick questions on nutrition. You said low sodium foods are important for people on high dose steroids. Just was wondering why it's particularly important for people on high dose steroids versus everyone else that also should.
So the question was, why is a low sodium intake important for someone on high dose steroids? It is for high dose. If they're on a lower dose, maintenance dose, then it's not as important. But a big part of it is the side effects of the discomfort, so the bloating and the discomfort that comes along with that. The sodium foods are going to make those worse. So, for example, if you have someone that eats a low sodium meal and then has a higher sodium meal later in the day, the side effects are going to be more bloating after that high sodium meal. There is also some relation possibly with the blood pressure. For some people, sodium levels can affect their blood pressure, and for some it doesn't. So there's also that element.
And then the second one was, you mentioned calcium levels. Is it recommended to check calcium levels, or what's the best way to do that?
So calcium's tricky because calcium is a very delicate balance in our blood. So if we do a blood test, it should always be pretty much normal because it's going to be taking the calcium from our bones as it needs it. So really looking at the bone density scans is a good way to measure if there's any change there. So you can talk to your doctor about that.
Normal blood work would show calcium also, wouldn't it?
In a normal standard lab work for JM, they wouldn't be necessarily looking at calcium levels for nutrition. So again, it doesn't, the calcium, a blood test for calcium in terms of nutrition is not the way we would monitor someone's bone status. So it would be more looking at the bones themselves through a density scan. Yeah. Not with vitamin A. Calcium, vitamin D also can go along with phosphorus and magnesium. So sometimes that's part of the conversation. It can be inhibited by iron. So we tend to, if someone is taking iron, we tend to separate the supplementation different times of the day. Vitamin A, you would want to look at how much vitamin A is also in the multivitamin, because vitamin A is one that you can get too much of. So you just want to look at those amounts. Separately, you might be okay depending. Separately, you might be okay depending on the amount. Yeah, yeah.
So the question was, your daughter is very active and experiences muscle burning, but she just sort of muscles through it and just sort of keeps doing her activity. But your question is that harmful, that approach? Does that summarize your question?
Yeah, is it harmful to her? Is she making her disease worse? And should she be stopping at some point?
So the question is this muscle burning phenomenon something that she should avoid? Is it a bad thing? Is it a good thing? Is that the gist of the question?
Yeah.
Perfect. Okay. So that's a great question. And part of the tricky thing with that question is all of us will experience burning in our muscles, as you pointed out, with intense exercise without resting. Right? That's typically due to a pH change in our muscle tissue. As we're doing a lot of activity above a certain threshold, all of our muscles burn at a certain point. And that's typical, that's a normal thing. It should go away when we stop and rest for a few minutes. It should go completely away. That kind of muscle burning is more typical. Right? The question with your daughter that's not exactly clear is she experiencing that kind of a muscle burn that we would all experience? Or is there something different going on related to the JM? And so the hallmark of a non-problematic muscle burn is it should go away. If you stop and rest for a few minutes, it should go away completely if it's a pH type muscle burn that we'd all experience. If it persists for a long period of time after she stops the exercise and it keeps going, probably more related to disease pathology. It would be a better question for your physician.
And what would a length of time be? Are you talking 5 minutes or are you talking 20 minutes?
Yeah, so if it's a healthy physiologic burn, within 5 minutes, there should be no more burning, right? Certainly if it's 20, 30 minutes and they're still burning, that's not typical response to exercise. And the big question is this making the person worse over time? So if you see the muscle enzyme levels are getting higher and the strength and the function are going down over time, that's definitely an indication of something going wrong with the muscles. And that's where the physician is a key piece of that question, to make sure that she may feel these symptoms, but if over time her function is not worsening, and then that's probably not as big of a problem. It's really the burning that doesn't go away when you stop the exercise. That's coupled with the loss of function over time. That's more pathologic. So does that help answer your question?
Yeah. When we ask her, is it?
Yeah, the real key there is how long does it persist, and over time is it changing? After several weeks, is it worse? Is it the same? Is it less? If it's typical burn you'd experience, it shouldn't occur as frequently as you adapt. If it's pathologic, then that doesn't matter. You can, it's going to be the same or get worse over time. So that divergence really shows you if it's pathologic versus something that we typically would see with muscle burning in healthy individuals. If that makes sense.
Yeah, absolutely.
Yeah, so we can chat more. You email me. We can go back and forth on this because it's an interesting question and it's very universal. A lot of people report that kind of phenomenon. Yeah, thank you. So the question was with a 5-year-old child wanting to do new things. How do you communicate to them, if it hurts doing this new activity, how to maybe pull back or how to feel free to engage? Is that sort of the... Okay, helping a young child distinguish between different symptoms, good and bad symptoms. Great question. And I am not the most experienced pediatric person in the room, so I don't want to overstep my expertise. Probably that would be, I would refer you to some sort of pediatric physical therapist who may be able to work with kids more appropriately. So I'm going to take a pass on that question for fear of giving you some bad information at this point. So, time issue for most people really is the good telltale sign. And I have some good PT colleagues that are pediatric physical therapists. If you would like, I could send you their email if you wanted to ask them a little bit further. It's a great question, and the age difference in education is often difficult with young kids, how to communicate and teach. And so I won't pretend to be an expert in that, so I'll take a side step on that one. But I can get you some better contacts if you would like some a little bit later. Thank you. Other questions? I think we're out of time, aren't we, about?
Yeah. We have about 4 more minutes. If there's any other questions. Good. Well, thank you. I think we've got about a half-hour break until the next session, so we'll see you then.